And so as I say, hello, my name is Campbell, and I wonder, as I say, because we've got 30 minutes, I'd really quite like to use this as an opportunity for you to network. So I think one of the best ways of doing that would be just, I'm going to go round, and I'd really like it if you could tell me where you work and what you do. So Andy McGowan, you're top of my list. I think we know what you do.
I think Andy just put in the chat that he had to pop away for a minute. Did I misread that?
Oh, thank you very much for monitoring the chat. Can everybody hear me? I just saw a note about. That's fine. Yeah, if we could try. Yeah, there's a bit of kind of rustling or something on the audio. So if everybody could mute until you speak, that'd be much appreciated. Thank you. I can't see the participant list on the chat box. Catherine Kennedy, hello.
Hello, you've actually got two of us. So my name is Catherine Kennedy and I'm a Carers Voice co-production facilitator. And my colleague with me is Sophie Little.
Yeah, Sophie Little, Carers Voice, Membership and Grants Officer, and we work in Norfolk and Waveney.
I don't know why I said your surname is such a question. Obviously it's your surname.
Hello, welcome to you both. The next one I've got is, it's a mailbox, ENHTR, Education Training. Hi.
Hi, sorry, that's mine, and because I'm on the phone, I can't work out how to change my title. So my name is actually Sonia, and I'm Education Lead for Palliative and End of Life at the Lister in Hertfordshire.
Brilliant. Welcome, Sonia. Fleur.
Hi, sorry, I can't switch my camera on because the Wi-Fi is so bad and I'll lose you all.
That's fine.
So I'm Thurrock Unpaid Carers Manager. So we support all unpaid carers through the whole of Thurrock with support groups and signposting, things like that.
Brilliant. Louise Hosmer.
Hello, I work for Carers in Hearts and I am the Development Officer for the Carers Urgent Break Service.
Ah, right. Very relevant. Roshna Mia.
Hi there. Sorry, I've just got my camera off. It's the reception's really bad, so it's intermittent. I'm Rushna, the BAME COVID Recovery Development Officer working with Community Development Action in Hertfordshire, in Hertford.
Thank you. Many thanks for joining us. And Sajdev Sian.
Hi, good afternoon. My name is Sajdev Sian. I'm with Hertfordshire Partnership Foundation Trust, part of inclusion engagement team working on carer development and support. I'm the carers development lead in the trust.
Brilliant. Welcome. Yeah, I'm already starting to see how these connections will work on this conversation. Vanessa Perkins, hi.
Hi, I work for a charity for unpaid carers, and they support Crossroads Caring for Life, Hertfordshire, and I'm the client partnership and engagement manager.
Brilliant. Thank you, Vanessa. May I ask, would you mind just noting that down in the chat box? Your audio is a little bit muted, and it'd be great if you could just. Deborah Whitaker.
Hi, I am working with NHSIE with the East of England region team as the regional lead for discharge and quality. And part of that quality agenda is a focus on wraparound services and improving experience for carers.
Wonderful, wonderful. Right. So, as I say, the first thing I'd really like you all to do is to network frantically. There will be points given for people that put their email in and connect. I think it's a really interesting group that we've got on this breakout room because of the mix that we've got of the NHS, carer services, education leads, you know, and I think one of the ways that, the only way that contingency working can happen is through joint working. Where do the plan go? How do people that need to access the plan? And in my opinion, the way that we do that is by getting people to talk to each other. So, to the point of the session, I have been asked, our work is, if there is an emergency plan, who do carers share it with? So, for example, I have a plan, I'm a carer for my brother, so what do I do with that? Where does it go? So I wonder, does anybody have any experience of working with carers that have a plan, and then sort of reporting that it's pointless because nobody can see it? Catherine.
You muted, Catherine.
You're on mute. Oh, we're going to have, right, I think we should have a signal. If anybody goes on mute.
Yeah, okay, thank you. So the first part of the question, I got excited and put my hand up, but the second part wasn't said yet. So you more want people who've got an emergency plan, but it's not being picked up.
Yeah. I think the reason we're discussing this is feedback, the feedback that we have had from carers. So yes, emergency plans are really important, but what's the point? And I think what we're looking for today is further examples of that. Is that normal? Is that a kind of common experience, or do people have other experiences? Is there a way that the emergency plan is connected sort of through the summary care record, or a bottle in a fridge, or one of those sort of many sort of contingency plans that could already be in place?
And so, as I said in the chat earlier, in Norfolk, carers are encouraged to register and have an emergency plan, and then obviously in need they call a line and that gets kicked into action. And
where is that plan hosted?
With Norfolk County Council. So online you could fill in a plan, and then that information is stored, and then they've recently revamped it, but they write to carers. They will write to carers annually to remind them to update the plan if needed. Carers get a fob and a card. But yeah, it very much sits with Norfolk County Council.
A fob? Yeah,
to go on a keyring.
So that's kind of addresses that issue that we heard earlier on about nobody having a wallet anymore. I'm the same. It's all kind of done on my phone. And what is on the fob? What does it say?
It has a phone number. It says that the person, I care for someone who needs me, and if there's an emergency, then please contact me.
Yeah, and I think it's got the plan number as well on the little fob.
Wonderful. So an ambulance, for example, if the person collapses and an ambulance service arrives, then the ambulance would be able to look at the key fob, and then they would say, this person's caring for somebody. We need to do something about that.
And as I understand it, that staff are trained to do that.
Wonderful. Andy and Louise, sorry, who was first? You'll have to.
Louise was first. I'll let Louise go in.
Oh, mine's only a very quick comment, reiterating the last. I mean, I refer on to the adult care, social care team for a carers assessment, and they've started now doing these emergency plans alongside them. This is quite a recent development, but however, we don't get to see them. They're not shared with us as an organisation. And yeah, I think there's quite a bit of work for us to do there with the adult care team in trying to establish some sort of link. It shouldn't just be a piece of work and then just left, you know. So that's a conversation that I want to take forward.
So, sorry, Louise, remind me, which service do you work for?
I work for a charity called Carers in Hearts.
Got it, sorry, yeah.
And I run the Urgent Carers Breaks service. So it's very relevant, really, to what I do. And yeah, I refer for these emergency plans or for the carers assessment, but I never get any feedback back. So it's...
And why is that? What do you think? What's stopping that?
I really don't know. I wonder if it's just because people do their piece of work and it's it's a tick in a box and it's done. I don't know. I'm very new to the organisation and I'm still trying to network in with the team that do these pieces of work. But that is a question that I need to ask.
Andy, is that something that you're aware of? This kind of one-way street sort of thing.
I think for us, so we work really closely with the carers assessment teams in the local authority, so that we get referrals quite a lot in from them. So we're commissioned to do the emergency scheme. So in Cambridgeshire and Peterborough, so we do the registration and the activation side from that sense. So in terms of the sort of referrers who come in, obviously they don't get a copy of the plan from that sense. Obviously that's with the carer, but we also encourage the carer to share them with relevant other people. So the carer gets a copy of the plan, but we say to them, actually, okay, it might be worth sharing this in terms of with your next door neighbour or your relative who you've identified as a sort of a nominated contact, but also it could be with their employer. So actually, in terms of if they are a carer and something happens to them, just having that easily to hand. And I think what we've done, so with the carers card and the key fob, exactly the same as for Norfolk, is it's doubled up as an ID card. So on one side it's just a general carer's ID card, this person is a carer, and on the back it says ring this number, they may have a plan. So what that's enabled us to do is where a carer doesn't have a plan in place, they've still been able to ring up, and then actually means if we can help and provide support, we will. But then it also means we can follow up with registering a plan afterwards, because often it's the ambulance service ring up, and they are getting much better from that sense to really ring us up and check from that sense. Same with out of hours GPs is another one who will often ring us up from that perspective.
It sounds deviously simple. Just to have that information on one place, and then for your comms kind of perspective, it's just one thing that you're selling. You know, it's really clever. Hugely,
and we've branched out for other groups as well. So parent carers, for example. So in the service we are commissioned to provide, we're not commissioned to provide replacement care for children, just because of, again, the replacement care workers who work with adults aren't sort of qualified to work with children, and vice versa. But what we found from parent carers is just having that plan, having that conversation in advance, and it means if something happens, we can take the stress away. We can ring the nominated contacts. If they haven't got any, we can ring social care on their behalf, because the reality is, in the situation which we get quite a lot, where you've got parent carer, single parent, if they have to go into hospital and there's no one else to support, it's going to go social care's way, because you've got children who've got no one to look after them. But at least that means then actually we can contact them. We have the information available from that sense, and it can just take that stress off for the parent carer.
Brilliant. And just before I come to you, Sashdev, I just want to sort of read out Vanessa's statement in the chat box. So Vanessa, just put in the chat box as having it sound. We work with carers to create their emergency plan to ensure they have it registered with a local authority. We help the carer to have the conversations with family, friends involved, and to get their agreement before they put them in the plan. Also to update each time a family friend may not be able to support it. The plans are short-term and long-term plans. So I think that's a really interesting point, Vanessa, about the spreading of the plan. It's write it and then make sure people are aware of it. Because from my experience on this work, one of the big things that gets in the way is, not gets in the way, but is information governance. But the thing about information governance is that if you have consent, then you can pretty much do what you like. So that kind of idea of giving the ownership of the plan to the carer so that they can say, this is my plan, then they are giving their consent when the plan gets handed over. So that's a really interesting piece of work. Sashdev.
Yeah, thank you. Thank you for this. I'm trying to take a leaf out of what Louise Hosmer has suggested, that once a referral has been made to the County Council for a care assessment, that information is sent out, but nothing comes back to you. And therefore, you don't know at your own level what has happened to that particular person and whether they feel supported or not. And the issue here is, you're absolutely right, Campbell, you know, people will hide behind this whole curtain of confidentiality and GDPR regulations. The idea is, you know, if we are to approach this whole issue about emergency planning on a wholesome basis, and recognizing that there are various partners to actually contributing to this wholesome approach to emergency, then clearly that is one of the very significant barriers. And I've also observed that sometimes staff have the information at hand. It may be on their computer they're looking at, but will not choose to share for fear that something wrong may be shared and that may have repercussions. So there is a staff fear in sharing this level of information. So and this stems from what the two stories that were shared, and I noted 3 key points that came out of that was each carer is unique. There are various what-if scenarios, and every day is different. And carers having to repeat their stories and messages depending on who they make contact with. And I think this becomes such a boring, laborious, and in fact, disrespecting issue, as far as carer support and emergency planning is concerned. So what we have tried to do, I don't know whether this can help, is through a co-production approach, we had Health Watch, third sector reps, which included Carers in Hearts, various carers and service users, and members of our Service User Council and Carer Council, developing 2 resources, and these are called Welcome Resource and Discharge Resource. And these are largely looking at entry into a service point, what should happen at that point in time, and discharge is at the exit, what should happen. So you're arming the carer with this relevant information that you have to hand as to who to contact, what to do. And one of the significant things that we find is the 24/7 helpline number. That is very, very important because you don't know when that emergency is going to creep up, what kind of emergency it is going to be. But what you want is you want a complete link in, and that link should be able to spread that message across, a variety of service providers so that we could fill those relevant gaps. Now, therefore, what we have done is we have a carer pathway, if I can share that with them. Care pathway is based on 5 steps. One is carer identification. I think carer identification, we can talk about emergency planning at whatever length we want to, but if a carer has not been identified, you can forget anything else happening. So carer identification is an absolute key, and my view on this is very simple, and that is when an initial assessment is taking place between a consultant and the service user, the best placed person to identify that carer is the consultant, because those conversations need to take place at that stage with a view that you can, allowing the principle of the triangular care, you can start engaging the carer at the very first opportunity. If that has not happened, we are missing the boat, really. And the second stage is making a carer welcome, and this could be done in the form of a welcome letter and various other means in terms of engaging the carer into the CPA process, or inviting them into a one-to-one consultation with the consultant. Now, how this is actually happening is anybody's guess, really, and experiences will vary from place to place. And then we have third, which is the carer support. Fourth is carer involvement, and fifth is discharge. Now, very often, if you look at emergencies creeping, if you have not involved the carer at the first stage, i.e. at the entry point into service, and then you have discharged the patient, and that too sometimes happens without the carer knowing or the family knowing discharge has taken place, you are literally handing over the care, professional caring for a service user, into the hands of a family carer. So how well have you prepared that particular family carer in terms of understanding side effects of medication, for argument's sake? What if scenarios that they may come through and they are finding it incredibly difficult to manage those kind of situations? Who do they turn to? So this discharge resource is another source that has been created through a co-production process, which will actually give the carer some link points, who to get to as soon as is practically possible. And these are, of course, over and above the fact that we have got the carer's passport, and we have got the lanyards that can carry your carer's badge and so on and so forth. The issue here is there is so much the carer can do, and there is so much the carers can't do, and they have to rely on services. And there are two types of services we are looking at, and that is statutory services, whether they come from a social care angle, mental health care angle, GP angle, or hospital angle. And then you have the third sector, and the third sector representation is absolutely vital, and they need to be linked into this particular process if things are to work and move forward at the emergency level. So
let me stop you there, because I'm aware of the time.
Yeah.
I'm frantically taking notes because I have a call on Monday with Doncaster Foundation NHS Trust and the local authority, and we're looking at developing hospital strategy. So we might just do what you've done.
Yeah, why not? And we're happy to share information.
That's absolutely brilliant. Nobody's got their hands up, so I'm going to sort of ask Deborah Whittaker, just with regards to that kind of idea of Sashta's kind of description of the carer discharge and carers clearly being the ambition being that carers are clearly part of discharge. Is that normal across the east of England? Is that practice replicated as part of out of hospital work?
I think it's very variable across organisations, and I think that's a big part of this work that is required. I think that 5-step approach is really helpful, and I think you've got to focus on that the early steps to get the discharge right. So yeah. And I've just been messaging Andy in the chat about because obviously I've only just very recently joined NHSEI, and
wow, welcome.
So I was working in Norfolk prior to this, and there was an extremely powerful young carer's story that was shared before I left, and I think listening to the stories that we've heard today, they're all very different experiences that we're hearing about, and there is a lot of work to do. And I think this conversation today is really key and important.
I'd quite like to kind of move the conversation to young carers. That hasn't been mentioned. And Andy, I don't know if anybody else has got an experience about emergency planning with a young carer. Surely that must be a legal requirement. I don't know. There must be something in place if you have a teenager looking after somebody and something happens. Andy.
So Adam touched on it in his presentation. I think historically emergency planning has always been in the realms of adult carers. It hasn't necessarily been considered on a sort of national level, and you've got two sides of it. One, you can say, is it appropriate, or actually you shouldn't be putting a young carer in that position. But actually, if you've got a situation where you've got a 16, 17-year-old young carer from that perspective, actually they may well be the primary carer. But also when we worked with sort of young carers in Norfolk on this, they said actually emergency planning to you is different to what is emergency to me. So what we did is worked with sort of some of the partners, including sort of Catherine and Sophie in Carers Voice, but also Norfolk County Council, to make a sort of a young carers emergency plan template. And so we worked with some young carers to come up with some different scenarios as to what's an emergency to you. So the emergency to them wasn't just if something happens to their own health, but it's actually what if something happens to the person I care for? What about if the power goes off from that perspective? What about what if mum gets COVID and can't work and we haven't got enough money to afford food? So again, there were some really quite sort of time relevant examples. And so what we've got now is quite a simple sort of emergency plan template that is owned by the young carer and their family. But again, it means they can sort of know what would they do in various different emergency scenarios from that perspective, but also they can share it, for example, with their school lead. So if they're at school and something happens, they can talk through, so there's a plan in place. So if mum goes into hospital, great, this is the plan that's already in place. If this happens, that's what needs to happen from that perspective. So I'm a huge advocate of emergency planning for young carers. I think it should be part and parcel of it. It gives that peace of mind, really.
Sorry, did you say plate? Did you say plate?
Template.
Template. I had a vision Of a plate.
Yeah, you put it in the kitchen cupboard. It's bottle on the fridge has evolved to plate. No, plan on a plate.
It's a plate and a Welsh dresser.
But no, it's been really positive, and again, it's early days in terms of uptake, but again, it just provides that peace of mind and prompts the conversations. So it means that from the commission service, their young carers workers can have the conversations with young carers about what would they do in an emergency situation, what would be their plan, what would happen from that perspective, and then it sometimes then leads on to other things for the family, like getting put onto the priority register for the utilities company.
Yeah,
something simple like that makes a huge difference in an emergency. So.
Before I come to you, Sasha, I'd be really interested if people could give me their opinion on this idea that you shouldn't have a contingency plan for a young carer because they shouldn't have to be in that position. I just think it's ridiculous. If we're applying for a code for a young carer, anyway, but that's my opinion. Sasha?
Just wanted to mention this, that as part of the emergency planning or contingency planning for young carers, I think it's very important to engage with the schools or the colleges that they're attending, because at some stage, not only will their education be impacted, but it will have a ramification on their future career employment prospects as well. So the issue here is, it is just not the medical services that need to engage with young carers, but also the schools. They have a very, very important duty. At our trust, what we have done is we developed some years ago a young carers booklet, which gets issued to a young carer, and it covers certain aspects of what to do if X, Y, Z happens. So it tries to give them the notion of saying, here are some of the approaches you can take, depending on what your circumstance situation is. And that's where we are on this, but work doesn't stop. But I do feel when you say whether such a weight load should be passed over to a young carer, really, it is very much dependent on the makeup of the family.
Yeah.
You know, I mean, if you look at a young, what do you call it, a single parent, I think somebody made mention of a single parent. And if the single parent actually falls ill and they're left with this child who eventually by default becomes the young carer, you really have no choice.
Yeah. It was your point earlier on about the emergency. Each care is unique. Each carer is unique, and each day is different. I thought that was a wonderful kind of observation. And Andy's point about what an emergency is. You know, the power going off. It doesn't have to be a heart attack. You know, it can be things that. Right. Sorry, I'm aware we've only got 5 minutes left and not everybody has had a chance to speak. So this is the time where I am opening the floor. If you feel that you haven't had your voice heard over the last 25 minutes, then now's the time to say or to put your hand up. Or if you don't want to do that, then obviously I've put my email in the chat box. And if you'd rather email me, I can get your messages out to Jodie. If you'd rather do it that way as well. And if not, just want to thank. Sorry, go on, Sonia.
Sorry, it's Sonia, or education as it's listed. I think it's really interesting listening, because obviously from an acute perspective, we tend to see patients when that crisis has reached boiling point, and admission to A&E is either the only option for the actual person being cared for, or obviously we have a lot of people, especially elderly, who come in who are carers for, you know, someone else. And it breaks my heart when you see sort of an 89-year-old who's the main carer for a demented wife who's now come in with a fractured noth because they've had a fall or whatever. So it's really interesting to hear some of the schemes that should be in place in the community, and potentially are. But again, I think it's about information sharing. and we don't always get that information in. Obviously, and Jodie used to work with me, so she'll probably nod and roll her eyes at this point, but you know, there isn't always that two-way information sharing. And actually, it's really interesting to hear the sort of Norfolk principle of, here's a phone line, let's phone and find out what the plan is in place. And that's a really interesting concept. And I don't know if we've got it in Hertfordshire. And if we have, I apologise for my ignorance, but again, it's about that advertising and that raising awareness of what's.
If you don't know about it, then, you know, that says something.
Yeah.
And sorry, I should have introduced myself. Hello, my name is Campbell. I work in the northeast in Yorkshire, doing Jodie's job, but I do it in the northeast in Yorkshire. But I do think all your points are valid. I'm an ex-psyche nurse, and you know, it's just there's all this talk, and then in the real world there's all this stuff. And what you need is one phone number. It needs to be simple for the person that's doing it, super simple, because your brain is thinking, react, save the patient. You're not thinking long term. It's just the way that health works. So that's I completely agree that the simpler it is, the better it is.
I think also under emergency situations, sometimes you will have to make assumptions.
Yeah.
The idea here is it is okay to make those assumptions, but it is equally important to check out those assumptions, because, you know, just imagine if a catastrophe happened,
Yeah.
or a serious incident happened, and you suddenly felt that the approach you were taking based on your assumption has gone really wrong. Where is the baseline here? How do you protect yourself as a professional, in as much as what is the onslaught you're going to face up to from various agencies, from the carer, from the carer's family, from the service user, and so on and so forth. So the idea here is, again, it goes back to record keeping as to where are those records kept that can be referred to. And therefore, if it requires a change of plan or change of approach in handling an emergency, that can be accommodated. So I think that's very important.
We're going to be sucked out of here, and when you're sucked out, it happens really quickly. So just anybody that's speaking and you get cut off halfway, I apologise. But again, it's that kind of Star Trek-y thing when you're kind of dropped and then sort of sucked out again. I just want to highlight Sashtav's point in the chat box about cultural barriers, and thank you for that comment. And also, with regards, here we go. About making sure that we personalise this and do it properly.